Poverty is a diagnosis, and a beauty brand just wrote $1 million prescription for it. Again, I'm not a big beauty brand person, but definitely this is something I can get behind because it's about the health of a community. Rhodes Futures Foundation just committed another $1 million to their Support for Moms Fund. That's a total of $2 million distributed to 10 organizations across the U.S., putting guaranteed income directly into the hands of new mothers, caregivers, and mother-like figures. This isn't just charity. This is a public health intervention. Let me tell you who's getting this money. The Bridge Project in New York, it's one of the largest unconditional cash programs in the country, starting during pregnancy and running through the first 1,000 days of a baby's life. The first 1,000 days. That's the window that determines brain development, attachment, and immune function. It's also going to In Her Hands, Georgia, which is putting cash directly in the hands of women facing financial insecurity. No strings, no conditions. It's also going to the Tender Foundation of Atlanta, a safety net specifically for single moms living on the margins. And then there's this one, the National Council's Community Love Fund. This is the first guaranteed income program for moms inside prison walls. Let that land for a second, because incarcerated mothers are still mothers, and their kids are still kids who need to have stable caregivers on the outside. Financial stress in pregnancy is not a social problem. It's a biological one. It drives depression, anxiety, preterm birth, and low birth weight. It crosses the placenta. Babies enter the world already carrying the weight of their mother's poverty and the social determinants of health. And then what happens? Those babies are more likely to have developmental delays. The moms are more likely to cycle in and out of emergency departments, which is exactly what Dr. Andrew Boozary has been documenting for years. And again, I want to shout out to Dr. Boozary because he's a physician who really gets it. And actually, I wouldn't have seen this about rhode if it wasn't for his feed. And big congrats to him again, because they have announced that they're doubling the Dunn House funding, a permanent housing program for people who are homeless and cycling through emergency departments. They're building a second lot because housing is healthcare, because stability is medicine. And the evidence on guaranteed income is not new and it's not soft. The Stockton Seed program showed reduced full-time employment instability and improved mental health. A randomized control trial showed that cash given to low-income mothers literally changed infant brain development, brain activity in infants. When a mom can cover rent, she doesn't end up in the ER. When she can afford childcare, she can go back to work or finish school. When she has stable income and stable housing, her kids are more likely to stay housed, stay fed, and to stay in school. Every dollar spent upstream prevents $10 in downstream crisis care. That's not a feeling. That is health economics. And I wonder if we could do something more about that today. The Support for Moms Fund is at $2 million. 10 organizations, real moms, real outcomes. Could we get it to $5 million?